Ozempic for fat loss in bodybuilding. Benefits, risks, and science. Introduction. In the world of bodybuilding, fat loss is usually achieved through a combination of strict dieting, cardio, and sometimes powerful metabolic enhancers. One drug that has recently gained attention in both the medical and fitness communities is Ozempic, the brand name for semaglutide, a medication originally designed to treat type 2 diabetes. Its main attraction for some athletes, it can significantly suppress appetite and promote weight loss. But as with any drug, there are potential downsides and risks. This video will explore how Ozempic works, why some bodybuilders consider it, its benefits, and its dangers. 1. What is Ozempic? Semaglutide. Ozempic is a GLP-1 receptor agonist, glucagon-like peptide 1. It mimics a natural gut hormone that regulates blood sugar and appetite. Approved by the FDA for type 2 diabetes management and in some cases for obesity treatment. Administered once weekly via subcutaneous injection. Originally intended to improve insulin sensitivity and control blood sugar, fat loss was observed as a side effect. 2. How Ozempic works for fat loss. Appetite suppression. Slows gastric emptying, meaning food stays in the stomach longer, prolonged fullness. Satiety signals. Increases satiety hormone activity in the brain, leading to reduced hunger. Calorie deficit support. Makes it easier to consume fewer calories without feeling deprived. Blood sugar stability. Helps avoid hunger spikes caused by sugar crashes. Indirect metabolic benefits. Some studies show improved insulin sensitivity, which may aid fat loss indirectly. 3. Why some bodybuilders consider it. During cutting phases, hunger can be the biggest challenge. Some bodybuilders use Ozempic to help adhere to a strict calorie-restricted diet without constant hunger. In extreme contest preps, it might be used to reduce cravings and binge risks. Particularly attractive for those who struggle with late-night eating or emotional eating. 4. Potential benefits. Significant appetite reduction. Easier adherence to a strict diet. Improved blood sugar control. May prevent muscle loss indirectly by allowing a controlled deficit instead of extreme crash dieting. Weekly dosing. No daily pills or multiple injections. 5. Dosage and use. Bodybuilder anecdotes, not medical advice. Disclaimer: this section is for informational purposes only. Medical doses start at 0.25 milligrams per week, titrated up to 1.0 to 2.4 milligrams per week depending on medical needs. In bodybuilding contexts, some stay at lower doses to minimize side effects while still suppressing appetite. Injections are done subcutaneously in the abdomen, thigh, or arm. Often used for 8 to 16 weeks during a fat loss phase. 6. Side effects and risks. Common side effects: nausea, vomiting, diarrhea, constipation, fatigue or dizziness, abdominal comfort. Serious risks: potential pancreatitis, inflammation of the pancreas, gallbladder problems, possible increased risk of certain thyroid tumors seen in animal studies, dehydration from vomiting or diarrhea, muscle loss risk if used with extreme calorie restriction. Body still needs adequate protein and training stimulus. Long-term unknowns. Ozempic is relatively new for weight management, so long-term effects in athletic populations are unclear. 7. Legal and ethical considerations. Prescription-only medication in most countries. Off-label use for bodybuilding fat loss is not approved by medical authorities. Always requires physician supervision for safe dosing and monitoring. 8. Conclusion. Ozempic is a potent appetite suppressant and can be a powerful tool for fat loss, but it is not a magic bullet. While it can make dieting easier by reducing hunger, it comes with real risks and should only be considered under medical guidance. In bodybuilding, it might help some athletes manage extreme cuts, but it is not without drawbacks, especially if misused.